Dear ladies and gentlemen, dear patients, my name is Christoph Neumayer. I'm a specialist in general and visceral surgery and in addition for vascular surgery. Since 2017, I'm the head of the Department of Vascular Surgery at the Medical University of Vienna. My education started at the Medical University of Vienna at the Department of Surgery, and I spent several months abroad, namely in smaller hospitals nearby in Lower and Upper Austria, as well as abroad, especially in Poland. And what may I offer to you? Well, the broad range of vascular surgery, ranging from the treatment of carotid artery stenosis, possibly causing thromboembolic consequences and infarction. The therapeutic treatment by especially open surgery in case of peripheral vascular disturbances and stenosis, treatment of claudication. In addition, patients with aneurysm formation, meaning dilatation of arteries, are treated by either open or endovascular surgery, irrespectively whether the aorta or other smaller arteries are affected. What I want to emphasize is that surgery is one of the main treatment strategies, but usually conservative and endovascular treatment forms are coming first. So it's basically the last therapeutic option to help the patients, and to avoid this kind of surgery, I want to offer a broad investigation, because cardiovascular diseases are nowadays the killer number one. So up to 70% of patients die from cardiovascular diseases. And in most cases, those cardiovascular problems do not cause any pain or specific consequences. So that's my invitation. Come to Wiener Privatklinik to get investigated and most probably to prevent from further surgery for vascular diseases. In addition, I offer also general surgery, special hernia surgery of inguinal or scar hernias, and cholecystectomies, or also surgery of the small bowel or the colon, as well as treatment of hemorrhoids and other anal disorders. Another advantage of the Wiener Privatklinik is that all the examinations being necessary for exact diagnosis and treatment are offered within the hospital, meaning that you have all kinds of X-rays, CT imaging, MRI, ultrasound, including also PET, which can be offered by the hospital directly. So you will be diagnosed within the hospital, and the further advantage is that there is a broad exchange between the specialists, namely angiologists, interventional radiologists, and conventional radiologists. And for vascular patients, according to the legal recommendations, before a decision, there is a vascular board, and the specialists are discussing all together the distinct problem of the patient. So you can be quite sure that that's not one single expert opinion, but the broad recommendation of the cardiovascular community, which will be offered to you. Finally, I want to emphasize that I'm especially trained in sympathectomy, an endothoracic operation which can cause relief of pain or necrotic fingers due to clamping of the sympathetic nerve. And in many patients, this treatment form is also indicated if they are suffering from severe hyperhidrosis. Please also do not hesitate to contact me in case if you are suffering from one of these burdens. Basically, I am looking forward to hear from you, and if you have further questions, please don't hesitate to contact me directly via email or by phone. All the best to you, Christoph, Neumayer.